it may be nursing home, it may be private polyclinic, or any setting where curative services, treatment, and management of patient is done. Uh, that is a main source of uh, infection if you go to the hospital. So, but a very important topic is that the waste generated by the hospital or in the healthcare setting, we have to manage. There are some of the steps given by the guideline is given by WHO. As per that, and the government of Nepal have also recently published, especially in the COVID period, what are the precautions we have to do. But this is a general. If you do this general thing in hospital as a routine wise, then there will be less chances of transmission of any infection. Okay. So first of all, first slides, you can see waste management. You know? Management is a very vague term. It consists of the waste generated in the hospital. You know that in the hospitals there are various units. Uh, uh, in science you can see the waste are generated, especially in the anatomy you can see, you know, and then in the clinical setting you can see the waste generated by the patient or from the wards, emergency wards maybe, it may be ICU or in it may be OT or it may be. So whatever, there are so many areas from where waste are waste are generated, and that waste may be various, we can classify it. So just in these slides, management, waste management, the definition is it consists of, first of all we have to collect, then we have to transport, and then as per the nature of waste, processing means how to dispose or where to keep and dispose, or where to uh, finally uh, we have to uh, manage that, means it do not contain anything so that cause infections, or generally hospital waste where recycling we do not do, especially what recycling process, so we use the or disposal and monitoring of waste. So within the hospital setup, there is this how to manage uh, this waste. There should be a setup of or the proper setup or proper uh, this collection mechanism, transport mechanism, and disposal mechanism should be there. You know, in any hospital or hospital units. You know. Now, are you getting me or not? Should be two-way communication. Please, it is not so big topic or very complicated topic. Please, I want some response. Okay, what is healthcare waste? Anyone can read it? So one of you can read it, no? The slide, what is written in the slide? Let me see if you are present.
Waste generated
Yes.
by healthcare institutions or
So I'll
hospitals.
know your roll number, and as per that assessment, I do the assessment on the basis of your response, your participation, your presence, not only just counting that. Okay. So please, what is there written?
Waste generated by healthcare institutions or hospitals. Research facilities.
Yeah, yeah. Continues. Research. So generally, healthcare waste means it is a comprehensive word. It consists of means wastage from the health care facilities. Care facilities may be the hospitals, very tertiary hospitals, or regional hospitals, or district hospitals, or it may be small, it may be government also, private also, and beside these hospitals, uh, there will be private dispensaries may be there, there will be private nursing homes may be there, or within the government infrastructure, there is PSC, Primary Healthcare Center, that is also a setup. Health posts are there. So, so these mainly these are. Please don't do like that. Okay. If you do like that, then please. What happened there? Hmm? If you do, you'll get this slide. No problem. Okay. Without a slide also, I can do. I can. So please don't try to control. Okay. Please, all of you, please listen to me. I know I can know we can understand. Please try to don't move the slides here and there, and I can control it also. But a simple thing, nothing to what is control. Okay. So waste management definition, healthcare waste simply by healthcare institution, hospitals, and the research facilities. In, in the hospital setup also there are research units in which, so in big hospitals there may be research going on, means experimental studies. Maybe in Nepal we cannot find it, but generally uh, if some research is going on animals, trials and all, and by in the laboratories to see the microorganisms or viruses or these things. Uh, so from where it is generated? It's generated from the hospitals, from various wards, emergency, and in case of COVID-19, we can say COVID-19 unit, and those who try to examine whether they have some symptoms or not. From there, it may be there from other wards, every wards, uh, and if there is research facilities and laboratories, from that you can get a lot of wastage is coming out. And during the diagnosis, treatment, or immunizations, you will get a lot of this series or these things I mentioned after this slide. So whatever we are getting from the hospital, that is it should be disposed. That is called healthcare waste. Okay. Now in the healthcare waste in the hospital or in dispensary also you can see not all the wastes generated or coming outside are hazardous. Yeah? So you can see there is the administration also. Administration is there, and most of the things coming from the administration is the paper type of thing, paper or plastics or suppose there are canteens are there. So most of the general waste are 75%, 75 to 90% is general. That is not so much infectious, while 10 to 25% hazardous healthcare waste means it is highly infectious. So it can if it come in contact with the human beings, or it may transmit the disease. So that you have to understand what is general waste and what is hazardous waste. So Generally, you can see I told you that waste can be generated. The types of waste that can be that is generated from the hospitals, maybe infectious. Suppose in a laboratory, after laboratory, we give the sample, and then after the sample, after using the sample, we have to discard that thing. So that is infectious. One example I given. Pathological waste in the pathology, for biopsy and all that is given, and after that, that is also should also dispose. That is also infectious. Shaft means vaccination, the syringe, needles that we use, that is shaft. So pharmaceutical means a lot of drugs, expired drugs, and these are expired and unused, or means that is no more of in use. That should also be disposed somewhere, and that is also a type of waste. Genotoxic waste generally in radiology department you can see the treatment is given by radiotherapy, etc. So that is more dangerous about X-ray, and then with all things. These are also, so the thing that is used to generate that radiation, and after that it should also be disposed. So it is genotoxic effect in the gene. Chemical, so a lot of chemicals are used in the laboratory, in the treatments, so many things are used. Chemicals, medicines also are chemicals. Heavy metals are also used. In heavy metals in the hospital, not only in diagnosis, treatment and all. So in the other infrastructure also, these metals are used. Pressurized containers, so in which the waste from the ward and other things are contained, and radioactive waste. So these are the some of the categories you have to understand. At least you have to know it. Means as if you can. So now in detail, WHO has categorized the waste. This is the hospital waste into I think 10 categories. So please remember that. It's very important. Category number one consists of human anatomical waste. So the you can see in the anatomy department, you dissect the body, and after dissection, so many of these all the tissues, organs, body parts, these things are generated, and that should also be disposed. So these are the anatomical waste. Category number two, animal waste. Okay, animal tissues, organs, body parts, bleeding parts, fluid, blood, and experimental animals used in research. For example, in the Manipal hospital, you can see these ships are means uh, some of the research means this blood is drawn from the ship, or it is some laboratory for microbiology department that is used. So these animals, uh, from that animals also, these bloods and these things, and waste, or whatever there is, and then colleges, you know. So suppose this is a medical college. So in medical college, in basic science, there will be a general waste, maybe plastic, maybe so from the canteen or from your room, this paper, wood, and these all the things is also considered as a waste, but it is a general waste discharged from hospitals, animal houses, etc. Category number three, you have to just remember, first of all, you have to remember that in category number one, there is a human anatomical waste. Then in two category, animal waste. Then in three category, there is a microbiology and biotechnology wastage. So please, anyone can read it. What consists of microbiology and biotechnology waste? before this Shriya Dinachan Shriya, so I have written a name also. So you have read it. At least you do some effort. So please, in category three, what is the classification? Anyone? Let me see who will respond, please. I will wait because just reading slide is not sufficient. You have to ask a question also. Please, you have to, and don't. Please, you're a medical student. You're not a general student. Anybody in category number three? Roll number 50 is there. Please, roll number 50. If you are there, you respond. Otherwise, I'll make my rule is that only just log in and then mute the mic and then that is not sufficient. Roll of 50, okay, I'll make it also. The roll of 45 is there or not?
Yes,
What?
sir.
So why you respond late? So please read. So category number 3.
Microbiology and biotechnology waste, waste from laboratory cultures, stocks or specimen of microorganism, live or attenuated vaccines, human and animal cell culture used in research and infectious agents from research and industrial laboratories, waste from production of biological toxins, dishes and devices used for transfer of cultures.
So in this whole this paragraph tells us that so microbiology or biochemistry or pathology, this is a type of laboratory. Generally, we are dealing directly culture microbiology after the use, after culturing or after the testing, and that this should also be disposed. That is more infectious. Uh, or in immunization unit, vaccines are used, and it should not be disposed just after using. It should not be just thrown in the container or whatever is there, because the sharp things are there, and it may also people may get infection as well as they can get injuries. Okay, so these are the things in category number 3. So now category number 4 consists of, please anybody, what is written in category number 4? And just
Sharp
we
wastage.
uh, excuse me, who is this roll
Needles,
number?
syringes, scalpels,
What is
blades.
the roll number? I appreciate. At least you see everything is there. Just you have to read it and review. Okay, roll number. Please carry on. Carry on.
They may cause puncture and cuts. These
Uh,
include used and unused sharps.
okay. What is there? Uh, Needles. No. You have to
Yes,
remember the major headings called waste. Sharps are also waste. Sharps means that needles, it may be used in various word, in OT also, in ENT also, in surgery also. Syringes are used in the blood bank or when you give your sample. Syringes are also used in the immunization process. Scalpels, blades, glass, etc. These these are called sharp waste. That may cause puncture and cuts also, and it can cause infection also. So whether it is used or unused, it should be properly uh, stored, and if it is used, it should be. So category number 5, who will tell? Jyoti has told. Now, please category number 5. So in the hospitals, you can see there is not only the treatment uh, and treatment of the patient, and then but discarded medicines and psychotoxic drugs. I told you, pharmacology department or pharmacy, so many things, so many tox means this all the drugs are harmful. No, if it is suppose if you take any drugs uh, that you do not know that what it is, so this is self medication process is there. So please and after using these drugs and all the covering of these things, boxes, this everything, contaminated and discarded medicines. These are also waste. Then contains in six categories soiled waste. Okay, items contaminated with blood and body fluids, including cotton, dressing. So these all are coming out from the various wards. You know? Soiled plaster cast, basically orthopedic department. Other material contaminated with blood. You know, material contaminated with blood. Suppose if you do the surgery of any patient, maybe that the things that we use, tools that we use, uh, scissors and all other things, it will be contaminated. Then we can reuse it by sterilization or autoclave or whatever is there facility available. Category number 7 is a solid waste. Waste is generated from disposable items other than the waste sharps such as tubings, catheters, catheters. These are all used to give the this IV injection or intravenous etc. Those patients who are very who cannot drink or who cannot take the medicines, so they are given intravenously, and those patients may urinating and this all the problems there, so these are used. So category number 7. Then I'll ask, okay, category number 10, category number 8 is liquid waste. So in general waste is also, suppose cleaners are there, sweepers are there, waste generated from laboratory washing, cleaning, housekeeping and disinfecting activities. So these are also the waste. Then incineration ash. So in every hospital there should be a incinerator. You know what is incinerator? Please interact or what the use. Incinerator you don't know what is incinerator?
Sir, burning.
Huh? Yeah, tell me whatever you know.
Sir,
So
burning.
freedom of
Burning the
speech.
waste.
Huh? Yes, please. I I do appreciate whatever you know. You tell it. Don't worry what others will think and what I will think. Let me think whatever I will think. Let others think. So what is incinerator? It depends.
Sir,
Anybody,
burning
please
the
tell
waste.
me. Huh?
Sir, burning the waste.
Okay. So this is a incinerator is a you can say it is a machine or whatever you can say. So this is a place or I think where the wastes after segregating means separating organic waste etc. and all the waste are put there. So it is chimney type of thing. So totally that work is so if the big hospital is there, then the this insulator is made with the so that it can bear high temperature means these all are put in the incinerator and the, that temperature will be 1500 to 1600 degrees centigrade and all. So the maximum temperature, uh, the, this, uh, all these wastes, these are burned. Some may not be burned, but volume may be lesser. Chemical waste, chemical, you use chemicals. Chemicals may be in the form of drugs. Chemicals may be used in the form of antiseptics or in the form of uh, cleaning. So, what are the biological chemicals? Etc. So now again I'll go. Please now can you remember? Just first remember the main topic. You know? So how many categories I have mentioned till now?
10.
10 categories.
10 categories.
Okay. So in 10, just first of all you should just know that what are the main theme in that 10 categories. In the first category, what is there? It is standard. See, in any textbook or in any hospital, guidelines are there. So at least you should know 10 categories. In the first category, what was there? Please
Anatomical waste.
call or
Anatomical waste.
Anatomical waste.
okay. So you should know, and then there is a description that what contains in anatomy. So number one is anatomical. Number two,
Animal.
Animal waste.
Animal waste.
animal waste that is used for the research purposes, especially the microbiology and other research units. Number three,
Microbiology
Microbiology.
and biotechnology waste.
so we're very that is these cases are very much sensitive. So we have to handle this all things because specimen, when we are dealing with the specimen and when we are dealing with this in pathology, we are dealing with this body tissues and all for the biopsy and all. So these are very and similarly, okay. Now after that, if you can remember this much only 10, then I think my objective is fulfilled. Or you can leave it. So number, what is number 3? Okay. Microbiology and biotechnology based, yeah. Okay. Then 4, 5, 6. Hmm? 4, 5, 6.
4 is waste up. 5 is discarded
Carb
medicine and
wastage.
cytotoxic drugs. 6 is
Hmm.
soiled waste. 7 is solid waste.
Okay. So thank you very much. Again, if you see the previous slides, then it's see we can categorize as this categories also, and then I'll show you now one by one. I'll tell you about these things. Okay, so at least you know what is this healthcare or hospital uh, waste management means it consists of from initial beginning from the collection and after collection what you will do, then you have to transport to the place, so that should be established within the hospital. A separate room or separate storage room should be there to store that first of all, you know. Then what should be done there in the hospital setting, there will be dumping sites, landfill sites, or incinerator is there. So these are the things that we can do there. Or second option is that we have to collect these things and we can transport in the these Pokhara municipality, these vehicles and all. We have to coordinate with them and then they will take it. But before that, there is some points are there. We have to Okay. What is the rationale for waste distribution? You all of you know that. Okay, to protect the people or food, water, or soil, whatever is there. So to not to prevent contamination. So now important waste management process. Please remember these points because it is important. Number one is segregation. Means we have to. So once you collect, you know, the waste from the wards, from the OPTs, or from the emergency, whatever is there. Actually, you have to categorize there only as a organic or inorganic, degradable or non-degradable. So within the wards or within the unit, there should be separation should be done. You know? And after separating, separated two things are there generally. One may be biodegradable and non-biodegradable things are there. So now these are taken to the department, storage room. There should also it should also be protectively maintained. Uh, then after that storage, and then we differentiate. That means we give some, we put in different bags, and then I'll tell you. Then this after the storage, we have to transport that to the disposal site. So according to the waste, some of the waste, uh, all the waste, maybe some of the waste before transporting to the disposal site, we have to treat it. Means we have to put some of the chemicals there, so that will be that will kill the microorganisms there only. So during handling and this thing, so after disposing also there is no chance for contamination. Then final disposal is there, and that should be there in the hospital, or if it's not available, then we have to coordinate with the government, and then we have to sort out that. So what is in segregation? Segregation means separation. You know, it is sorting the waste into color-coded plastic bags or containers. So whatever waste is generated by the patient or by the procedure of treatment, or uh, these things, or procedure of surgery, or whatever things are there. So there only we have make a different types of bags, or we have to keep different colored bags that have different symbols. Okay, suppose see, it is written there, segregated into containers bags at the point of generation. What do you mean by that? So wherever the, suppose in the emergency department, cottons and this all the things are there, you know? Even medicines used, immunization after vaccines used, or anything that is generated, that should we should keep the containers with different colors, you know, and then we have to dispose there first of all. After that, we can collect as a whole. So now after this, you have to understand these things. Color coding is very important. So you have to know that what type of container color should be there for what type of waste category. So there is yellow plastic bag or yellow container should be there. So by this seeing this color only, we can know that what type of waste are there, and as per that waste, we have to set separately. We have to store, and then we have to make it separate, so that while disposing, some can be insulated, means burned, some can be buried uh, buried under the ground, or some may need proper this in landfill side, outside this road. So yellow color bag, in yellow container, what should be there? Exercise tissues from the this. I think in from anatomy also, or from this pathology also, biopsy tissue, this tissue human, so these human cells and tissue and cell cultures, after doing the culture, there may be this sample taken, this test tubes, or sample taken, this what is called that. So from that we have to put yellow. Red means disinfected container, plastic bag. So what is this disinfected container? Okay. So red is contained in like cotton used. This may also contain blood or whatever is there. It is the infectious dressing and other material contained with blood. Laboratory process specimen of whatever specimen we give, of urine or whatever is there. These contain microorganisms. So. So we have to, I think we have to put that in the red container or red plastic bag, and then we have to put some chemical so that this microorganism will die there only. Okay. Otherwise, while handling and transporting, there is again possibility that the infection may be effect to those person. So blue or white. This plastic bag or white colored means gloves, tubing, catheters, intravenous set, these are the things. Black plastic bag. Uh, so now from here, what you understood? Understood? What is the main process of what is the main process of waste management, hospital waste management? Four steps are there. Nothing is difficult. First of all, step is what? You can tell in your own words. No, there is maybe you can find difficulty here, but the simple language is tell me what you have to do. First of all, roll number 20 is present or not? If you not respond, then I'll make you absent. So a lot of absent will be there, and this absent, this attendance is very important because in the online class there was circular. Okay, roll number 20 is present or not? Okay, I'll make it absent. Then roll number 10.
Yes, sir.
Okay, please, can you tell what are the steps that we have to follow to manage this hospital waste?
For waste management, first we do segregation of the waste at the time of generation.
At the point,
Point
means suppose in the emergency, there only we have to collect. This means we have to collect the waste, and we have to put in different colored buckets or bags, and we have to label there. Okay, in the
yes,
ward
sir.
or whatever. Okay,
And
now
after
then.
that, storage is done, and then transportation, and finally the disposal.
Okay, then storage means then we collect all the this yellow, red, or blue or black colored containers or bags into storage room, maybe maybe in the hospital there is established, and after that, after putting all the waste, so it needs daily basis we have to do that. On daily basis we have to dispose properly. Then what we'll do? Segregation.
Storage and transportation.
Okay. Within the hospital, so in the Manipal teaching hospital, there is a there must be a mechanism that see there are cleaners, sweepers, and some workers are there. So they are, I think, they are oriented, and they have to use safety measures. Means while handling this. They have to use the gloves, they have to use the mask, and they have to use some PPE or whatever is this clothing, you know, so that because these people will collect, and then small trolley or small uh, this cart or what from where they can take to the disposal site. You know? So stored. After in the storage also in the waste there is some chemicals are added, so that within that waste also, so there is no chances mostly all the microorganisms they will die out. So this is the color scheme. So now can you tell what is the how many color codes are there to contain the to store means to collect and put in the container? Please tell me how many colors are there, and what does that color container or bag mean? Anyone? There is in the slide. No, you can see it. Okay, it's a butter. Please tell me.
Yes, sir.
So just tell me yellow. So how many colors containers are used?
4.
Okay. So number one or two, either you can say yellow color container means that is colored with yellow. In that, what type of wastes are collected?
Biopsy tissues, excise tissues, and various
You have
other
to remember
human and animal cell culture.
yellow, and then red. So we
And
have to remember
in
that yellow, red, blue, and black. No.
yes, sir.
So this coding you have to understand that, and we can also in the hospital also after that, no problem. How they are doing, whether they are doing properly. I have one protocol, totally guidelines step by step, and I can provide it, and for that is going on now. You can check it also, and you can give some recommendation also. So labeling means after collecting suitable containers as per the nature of the waste, what we do, we have to put what type of waste. This labeling means we have to label it like category of waste. What type of category is there? So how many categories we have discussed till now? 10 categories, no?
10.
So out of 10 categories, we, these waste yes, mention that which category is there, then on which date that was collected, and then where it was produced, which ward or which unit or where it was produced, and then what is the waste destination means how where it will be stored and then where it will be disposed. Tentative, there may be a protocol or format in the hospitals, whether they will do within that hospital if everything is available, or they will send to respective government departments or municipality. They have to contact, and they will send you vehicle, or they will, if you want to have large quantity of this thing that cannot be managed in the small hospital or small nursing homes, then they will. So, um, collection, we know that at a point or at a site where the wastes are generated, from then only we have to separate. So we can separate it basically, we can separate biodegradable and non-biodegradable. It's very important, and we can separate, and then these are fed into this. whatever label, whatever colored container is there, in that we can put it. Okay. Now transportation very important during so from every ward or every unit, again that is collected as collected in some big containers. So while doing that, collected and it is taken to the storage unit or storage places, where it is made. So that can be in the hospital. There is a, that's why hospitals are made in such a way that small that trolleys and small that thing, small that what you can say is transport two wheels or three wheels, very small three wheels trolleys can be used. So it can be there are four floors, then it can go to four floors also. No problem. If it is not written, then manually you can do that. Transportation from the point to the on-site of the specialized trucks marked with symbols noting the type of vessel. So it's generally concerned that if the waste are taken outside, means if you don't have incineration, if you don't have proper dumping sites or things, or then it is transported. So we have to follow, or there is a regular basis that at particular time these vehicles will come, and then we have to uh, put there, and the labeling and everything is there clear, and they will there is unit and they will manage. Okay. Then transportation. Now disposal. This is the very most important. If it is within the hospital, uh, how you will dispose? Outside also, they have mechanism, or they have proper disposal way. So number one is incineration. Then you can dispose either by incinerating, by burning the total waste, or you can treat with thermal, means high temperature. Chemical disinfection can be used before disposal. Land disposal, microwave irradiation, and encapsulation. So I will. So in next slide we'll see that what is that. Okay. So incineration, everybody knows in our hospital there is well established incinerator, and that has a that can resist heat or temperature till 15 or 1600 degrees. At that time, everything will become burnt and become ash, means the volume is very reduced. Now, second thing that you should know. So, this incineration is used for infectious waste. So, we don't want any chance uh, by burying or whatever dumping or anything, so that it is very much infectious, and it will be the source of infection. So it's totally burnt. Sharps and pathological waste should be totally burnt to ash. All chemicals and pharmaceutical wastes, including toxic waste. So these are the things. These are the wastes that is preferably used for the incinerator. Okay. Then next, what is there? Anybody can read what is wet thermal treatment? I'll finish. There is no more, not many slides. What is wet thermal treatment? Wet thermal is based on exposure of infectious waste to high temperature, high pressure steam, and is similar to the autoclave or the sterilizer process. So if you do these things, and after storage also, uh, this infectious waste is treated with this thing, then it is free of microorganisms, and then can dispose it safely. Generally, what are the things that we can use autoclaving and all, commonly used only for highly infectious waste such as air. So definitely it is used for highly infectious. And one of the important thing is chemical disinfection. I'm not talking about disposal. Before disposal and in the storage only, we have already categorized different types of wastes are there. And for the nature, in plastic bags or containers, we have to put some sodium hypochlorite or some bactericidal or virucidal chemical. We have to put there so that whatever things is there active, it will make them inactive. Right? Chemicals are added to waste to kill. So it is not disposal method, but it is one of the precaution method. Right? So this suitable for treating liquid waste such as blood, urine, stool, and sewage, and whatever is there. So these chemicals are added in the containers where it is stored. In that other is microwave irradiation. Uh, the waste, so this is one of the types that if you have this type of instrument, then you can put you have to have very big irradiation chamber. So it is sophisticated also. You don't have then simple some chemicals you can add. You can autoclave that. Suitable for waste and stuff. So you can so land disposal. So open dumping should never be done uh, for any waste. Sanitary landfill means you have to make a bury. You have to make a deep bury this. You have to deep bury. Bury means buried. Whatever the words is not coming to me. So this involves filling container with waste, adding an immobilizing material, and sealing the container. So this is called encapsulation. So you have to understand what is the meaning of encapsulation. Uh, some of the things, suppose if you put in the container and you transport it, or then at a time we have to make it very rigid. Means even it is moving, then it is not scattered here and there. So we have to put some metallic things, or we can use some this, uh, sand or whatever is thing there to make it so that it cannot move. It cannot be easily moved within that container. Then, so this is the thing. The container or box are filled up with the medium to plastic box. So that suppose if you make it safe. Suppose if you buy a television or whatever, or a refrigerator, then it is there is a box, and there is a plastic foam is put in the bottom and in the above, in the side also, so that if something happens, then it will protect it and protect it from moving. Now, disposal towels and tissues, these are also once it is used, it may be sterilized and reused, but some of the things, some of the clothes that should be disposed uh, in trash container lined with plastic. Okay, I think these are some of the things that is. So now, in summary, I want to you have to know that. Okay, in summary, you have to know that what is hospital waste, Okay. The main important thing I told you, generally what different types of wastes are there. And this is the important slide. I'll show you uh, this color. Okay, these these are the some of the waste types of waste. So you have to understand infectious, pathological, that you should be able to uh, know, and you should be able to write. Then there is important category. There are 10 categories WHO has divided. As for that category, different methods are used, and then what the process of simple process: segregation, storage, transportation, and final disposal. uh, and segregation, these all things and color coding is very important. So three things are very important here. That number one, you have to know 10 different categories. Okay. Then process means segregation. Then what is there? Transportation, and then storage, and then disposal. And color coding is very important. You know, if question is asked that what type of waste comes under the storage of this type of color, then labeling, it's important. Then you have to know this terminology: incineration, encapsulation, wet thermal. What is this? This is your homework to make. So you are not responding and you are not asking any questions. So there is no any point whether I explain or not. You know? So if you respond, if you participate, then only I know that how much things, how much I have to share the things. So okay, by this I think I have to stop. You know? Okay, yes or no? You couldn't yes.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
What
Yes,
yes?
sir.
What I told.
Yes, sir.
What I told. To stop it, no? Huh?
Yes, sir. Yes, sir. Stop.
So what are the major things I told you to remember? Just anybody can tell me, and then I'll stop it. Major points to remember here. Rest of the things,
Categories of wishes.
okay. There are 10 categories. You have to know what are the categories, and in that categories what are things are there. And especially there are some of the divided into pathological, infectious, whatever is there. And then second important thing is that color, color
Colored,
scheme.
color-based segregation of waste.
Color based container should be used, or plastic bags should be used. It should be labeled. And I think two or three things are there that you have to understand. And various process of disposal. I think I will give you in detail, or you can see the references you can find anywhere. So, I think I'll stop here, and then in the next class, if I have the opportunity, then we'll discuss about it. Okay. So if we are planning to have an examination also, so maybe some MCQs will be asked to you, and please, if from the hospital base also the one or two three questions will be there. From the solid waste also, solid and liquid waste, there will be some of the questions. From the water and from the air pollution and whatever things I have covered, from there some MCQs will be there. Okay, please remember these things. If you have examination in MBBS given there, you have to go through it. Now please, I will stop here. My time is. And please, Patisma, where are you? How are you?
Okay, sir. I will send you.
Oh, thank you very much. So, I don't know how much I was able to tell you, but if you respond me, then okay. Okay, whatever, if you have some files, you can put in the chat. Okay. So, thank you everybody to be there, and best wishes after the class that life will go happily and successfully. Okay. Thank you very much.
Thank you,
Thank
sir.
you,
Thank
sir.
you, sir.